Welcome to Nasdaq Trade Talks. I'm Jill Malandrino, global markets reporter at Nasdaq. COVID-19 forced the healthcare industry's issues into the spotlight and served as the catalyst for innovation. Joining me to share lessons learned and what the future for healthcare could look like is Dr. David Nace, Chief Medical Officer at Innovaccer. Dr. Nace, welcome to Trade Talks.
Great to be here, Jill.
All right, before we get into the conversation, I want to understand the backstory behind Innovaccer. How did you get that name for the company?
Oh, great question. So the concept was to build a data platform that could accelerate innovation. Innovation accelerator.
I like that. So how has COVID-19 changed our healthcare system for the better and for the worse?
Great question. So COVID-19 has been a bit of a forcing mechanism or catalyst for us in healthcare. Before this, no one ever used telehealth, maybe 2 or 3% of people. And suddenly we were forced to use it because we had to take care of people in their homes. And we had to make sure that we address people's issue about being safe to come into the healthcare system. So it's been a forcing mechanism and actually a catalyst for innovation, which has been very exciting. And it's really brought to light the need for value-based care, which data is a key element.
What can the healthcare industry do to take a more patient-focused approach, and why does that matter?
So we have a lot of disconnected silos and people in healthcare. There's a lot of friction, right? You have to make an appointment with your doctor, maybe 6 weeks out, get into a car, drive, get a parking space, take a day off of work, fill out a piece of paper on a clipboard, somebody data enters it, and there's errors. There's data systems that are legacy that are built for different purposes. They've really been driven by the application. There's a data system for registration, there's a data system for your doctor, there's a data system for nurse notes, so on and so forth. So we have all these silos, no complete view of a patient. Think about it when you get on an airline and the stewardess comes up or the steward comes up and says, "David, do you still take almonds with your sandwich?" And it's great that you're a gold member. You feel like they know you. And this is the way healthcare should be. And we have all these specialists and all of these services, they're all disconnected. They don't work to serve the patient as one. It's not a patient-centered system.
What are the biggest hurdles that healthcare organizations have to jump with their data, and what are the implications for patients? Because the data conversation is front and center right now.
Absolutely. We've done great efforts to try to collect data and try to digitalize healthcare. But we've built technology like the electronic medical record for a system that was driven in fee for service. And so we built these data silos and we forced people to become data entry clerks. Think about it when you see your doctor today as opposed to 10 years ago. Their back is turned because they're so busy entering data. And all this data lives in disconnected silos and it's not so useful. So it's time to really pull all that data in, which is what we do here at Innovaccer, from all these different sources, harmonize the data, unify it, create unified patient records, and make that available in real time, and not only real time, but put AI-driven workflows into the workflows of all the folks in healthcare, the doctors, the nurses, the specialists, the patient with their their smartphone. And so everybody's working as one. And the mantra we use for that is care as one. How can we bring collaboration of a service to really improve the efficiency of care, the patient experience, and the outcomes of care? And ultimately, reduce the cost of care, because the cost of care is extraordinary in this country.
It certainly is, Dr. Nace. So the question is, what does the future look like for patient care in the wake of COVID-19? Because as a consumer of healthcare myself, if you can have everything more cohesive and all the doctors and healthcare workers are communicating with each other, I think patients would be more apt to go for preventative care, and it wouldn't feel like it was such a project and they had to take all this time off of work.
No, it's a great question. We often talk about this as what is the new normal that will come out of from this pandemic. So I have a couple of stories to tell you. Michael Levitt, who was head of Health and Human Services, former governor of Utah, he has a Levitt Foundation. And Michael Levitt said about 3 months ago, he said, one of two things will happen, given his experience with a prior near pandemic when he was in the Health and Human Services. He said, one of two things will happen. It'll either accelerate us into the future in terms of virtual care, connected data, just like we have in other industries, Amazon and retail, supply chain, Google and search, Netflix and entertainment. We don't have that in healthcare. It'll either force us into that future, we've talked about it for so long, or because of the financial hit that many may feel, they may go back and try to leverage the money by billing more services that may not be needed. So we have to be cautious of that. And the other story is my friend Michael Dowling, who's the chief executive officer at Northwell in New York. They were hit very, very early on. And, he said, he's got a great accent. I can't imitate it. But he said, in the old days, it would have taken me about 3 or 4 years if I wanted to expand my beds by 200. I would have had to form a committee. They'd have to study it. They'd write a budget. My CFO would push back, blah, blah, blah. Instead, it took me 5 days with COVID. So this is the whole issue of catalyzing, right? The catalyst that has really accelerated things. And patients find they love getting care at home. I had a dermatology visit the other day from home. It was great. I didn't have to take time off of work. I didn't have to drive, find a parking space, worry about the exposure to COVID. And so now that people like it and doctors like it, this is great. So if we can bring AI-driven workflows and unify records and really automate the inefficiencies in healthcare, and we've done that for many of our clients, doctors feel and nurses feel, they feel like they're going back to practicing medicine again. They're spending more time with the patient. They're really focused on the need, and the patients really enjoy it too. Ultimately, we get better quality care, improved outcomes, and lower costs.
All right, Dr. Nace, appreciate the insight. Thanks for joining us on Trade Talks.
Absolutely.
And thanks for joining me. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.